Hello, it's Amy Krentzman back with Module 2 of a series of 3 modules for child welfare workers. The topic of these modules is a study that I conducted on the effects of gossip on addiction recovery in rural communities. And I'm also going to talk about implications of the results of my study for child welfare workers and for other health professionals and social service professionals as well. So you met me in Module 1, here I am again, and I thought just to, rather than repeat what I said in Module 1, I would just tell you some of the highlights of some of the other research I've conducted. So to me, my most interesting study of spirituality was a study I conducted about the ways in which Alcoholics Anonymous results in abstinence and lower levels of alcohol consumption. In that study, I looked at the effect of Alcoholics Anonymous on different dimensions of spirituality. And what I found is that the individual private behaviors of prayer and meditation explain one small part of the ways in which Alcoholics Anonymous helps people with recovery. People go to AA, as a result, they do more prayer and meditation, and as a result of more prayer and meditation, they maintain their abstinence or they have fewer recurrences of use. I'll tell you that in my study of forgiveness, I found that it was really interesting to discover that forgiveness of others came first, and then after that, people were more able to forgive themselves, that forgiving others was easier than forgiving themselves. And this was in a sample of individuals who were in recovery from addiction. In my study of sober living homes, I found, as you might expect, that people who had a co-occurring mental illness had worse sober living outcomes. And finally, I'm doing a study right now on journaling, the effect of journaling in supporting addiction recovery. And what I've found in that study is that people who did a certain kind of journaling that we call positive peer journaling, while they learned and practiced the journaling, they experienced increases with satisfaction with life, increases in well-being, increases in rewards from the environment, reduced craving for drugs and alcohol, increased happiness with recovery, increased confidence in staying sober, reduced depression, and reduced feelings of demoralization. Now, in that study, there was no control group, so we can't say it was the journaling that caused all those benefits. Maybe all of those good things would happen for people anyway over the course of recovery, but the fact is that it co-occurred with their journaling practice. So future research will tease out the specific impact of journaling. Anyway, I hope you found that at least a little bit interesting. At the end of this slideshow, I will give you my contact information if you'd like to learn more about the other work I've done. Again, I just want to stop and thank you for all you do for families, the tremendous difference you make in their lives, and how much I and my colleagues at the School of Social Work appreciate what you do. I want to thank the people who gave me the funding to conduct this study and other studies. So in the previous module, we talked about the background to my research study on the effect of gossip on addiction recovery. We talked about how rural is defined. We talked about substance use across the country and specifically in rural communities. And we talked about recovery from substance use disorders in rural communities and the research literature that described both strengths and drawbacks to recovery in rural communities. This is the second module, and in this module we're going to go ahead and talk about sociological conceptualizations of gossip. We're going to talk about shame and stigma in addiction recovery, and of course gossip, or being gossiped about, finding out what people are saying about you, or worrying what people are saying about you, caused a great deal of shame in the people in the research study. Then we're going to get into the specifics of my study. I'm going to give you my rationale for why I conducted this study. I'll tell you about how I conducted this study and tell you about the community and the sample characteristics. So let's go ahead and launch into module number 2. We'll start with the sociological construct of gossip. You might be interested to know, or maybe even surprised to learn, that sociologists, social psychologists, and anthropologists and others have actually studied gossip. It's been the focus of research. Definitions of gossip that we found were informal and evaluative talk about a person who is not present among people who are familiar with each other and share a common frame of reference. Another definition involved the fact that gossip is defined by the context in which the information is shared. So it isn't gossip, for example, if a person is talking to their therapist during a therapy session and that person is talking about third parties who are not present. Because of the context, that would not be considered gossip. What this author, Rationale, says is that for it to be gossip, it would have to be what he called idle talk. Another example is if you've just interviewed a job candidate and you're talking with your colleagues about the performance of that job candidate in the interview and the things about them that would or wouldn't be a right fit for the job, that's not considered gossip because it's not idle talk. Gossip is morally and judgmentally oriented. That is, that gossip relates to people who are doing things that are judged as good or bad. Now, interestingly enough, we think of gossip as predominantly negative, but gossip can have some positive roles in the social world, and I'll talk about that in a coming slide. Gossip is also defined by the nature of the information shared, whether it's superfluous or not. So let's say you're discussing that job candidate, but you digress from their characteristics for the position, and you talk about things like maybe their hairstyle or the kinds of shoes they were wearing or their tattoos. If you digress and talk about things that are superfluous, then it would meet the definition of gossip. So gossip has been found to serve some positive social and psychological purposes. First of all, gossip spreads news and information, which has been found to be especially important in rural communities. Gossip enforces social control. It reinforces group boundaries and censures the actions of people crossing them. Gossip fosters intimacy. I think we've all gossiped as human beings at one time or another, and we know that feeling when we're gossiping with someone else. It forges a bond between us and the other person that we're talking to. Gossip can make people feel better about themselves by a process of what's called downward social comparison. The person might say, well, I'm not as bad as so-and-so at least, and that might make them feel better about themselves. Gossip can help a person sense whether they are in tune with others. In other words, am I in agreement with the person who I am gossiping with about the third party who we are talking about? And am I myself conducting myself in a way that is socially sanctioned? Or am I outside of that parameter of what's socially acceptable? And gossip can help me rein myself in if I'm acting in ways that are not socially acceptable. If people are gossiping about a third party and that they're doing something bad, I might say to myself, I better not do that. So this is how gossip can support social control in a community. Gossip in rural communities has been shown to have a negative impact on well-being, especially for people with health and mental health conditions. So across the world, and in various regions, when people are in rural communities, they are worried about gossip, and gossip has a negative impact on them if they're someone with a mental health or a physical health condition. There's been a study of the anxiety that gossip causes people with cancer in rural Scotland. There's been a study of the distress and social isolation caused by gossip among adolescents needing mental health care in rural Australia. And according to a wide range of different studies of rural communities, gossip has been shown to cause a disinclination in seeking help, whether that help is health care or mental health care in rural communities. We're going to move on now to a discussion of shame and stigma in addiction recovery, and that is because people in my research have said that when they were gossiped about, when they found out they were being gossiped about, and when they feared what people were saying about them, about their active addiction and also about their recovery, they felt a tremendous amount of shame and stigma as a result. The main text, although in many ways dated, the main text on stigma is still the book by Irving Goffman, the famous sociologist, and his book Stigma: Notes on the Management of Spoiled Identity. He said that stigma arises when someone is different and is viewed as, quote, tainted, discounted, or less desirable, bad, dangerous, or weak. Generally, there's been a great deal of research on stigma as it relates to addiction. Lloyd conducted a literature review on the topic of stigmatization and substance use. And what Lloyd found is 185 academic papers on stigma and addiction. And what those papers had to say is that in research that surveyed the general population, they found a high degree of blame for a person with a substance use disorder. So that would be blame that it's that person's fault that they have an addiction. Addiction is a disease. Addiction is an illness. And you wouldn't say that that person caused their own addiction any more than you would say that person caused themselves to have cancer. In the lit review that Lloyd conducted, Lloyd found that surveys showed that even some health professionals had stigmatizing attitudes towards those with substance use disorders. Lloyd found that that stigma was also experienced by police officers, and this surprised me, stigma was experienced by others who are also addicted. So in a group of people where they all have substance use disorders, those who are more severely addicted are stigmatized by those who are less severely addicted. His research showed that negative impact of stigma on people with substance use disorders caused them emotional pain, anxiety, and poor self-worth. And the literature review showed that stigma can interfere with employment once people are sober. Again, if we were in person face to face, I would ask you how you would answer the following question. True or false? I have talked with clients about the impact of gossip on their well-being. So I'd be super interested to know whether you have intentionally asked about the effect of gossip on your clients. Also, if we were together, I would ask you true or false. I believe gossip can contribute to relapse or recidivism or other profound negative consequences for my clients. In a webinar I gave recently, about 80% of the participants said yes, that they felt gossip could be so painful and so troubling to people that it could cause them to digress in their recovery attempts. Next, I will tell you the rationale that I used for doing my study on gossip and addiction recovery in rural communities. So my rationale for the study was number one, addiction is a costly and devastating social problem. People can and do recover from addiction, however, but we do have some evidence that recovery might be more difficult or problematic or complicated for people living in rural areas. We know that gossip happens everywhere, but we have learned from previous literature that gossip might be more central to rural life. And we know that gossip can cause pain and stigma for people, and it can negatively impact other health conditions, other mental health conditions and physical health conditions. But there was no previous work on the effect of gossip in rural communities on addiction recovery. So I decided to go ahead and study that. The specific aim of the study was to understand the role of gossip on addiction recovery in small towns and rural communities in one region of Minnesota. We'll move on now to an explanation of the methods I used to conduct this study. I used qualitative research methods to conduct this study. Qualitative research involves reading and rereading the data. You become very, very close to the data. And in this case, the data were a set of 35 interviews I conducted with people who were from one rural region of the state of Minnesota. So I interviewed 35 people once. Me and my research assistant interviewed 35 people one time each. I'll be telling you on a future slide exactly what we asked them. We recorded those interviews, and then we had them transcribed, and we read them over and over. And that is what is required for a qualitative study. We identified content in the interviews that was related to our research question about gossip. We clustered similar content together into themes. Then we interpreted how the themes related to one another. And then we drew a picture that depicted the ways in which the themes related to one another. And this picture is called the conceptual framework. And in module number 3 of this series, I'll tell you how it turned out. And I'll show you the conceptual framework and describe it for you. And then once we drew our first picture of the conceptual framework, we read and reread the data again. We adjusted the picture so it matched the data. And then we read the data again. We adjusted the picture again until finally we were able to say to ourselves, this picture accurately reflects the data from the interviews. And that's a process called grounded theory. So here are some of the interview questions we asked participants, and the interviews were what we call semi-structured. That means that we started with a script, but we let people go off the script based on their answers to the questions. We asked, what is it like to provide or receive substance use disorder treatment in this region? What is it like to be in recovery from substance use disorders in this region? What are the challenges that face individuals in recovery in this region? What strengths are employed to overcome any obstacles to addiction recovery in this region? And we recruited people who had firsthand knowledge of addiction and recovery in a rural community in the region, either from their own personal experience of recovery or because they were in the addiction treatment field. So what were the characteristics of this rural region where we recruited participants? Well, we recruited individuals from 13 contiguous counties in the state. Now, the Minnesota Demographer's Office has come up with a way to sort every county in Minnesota according to one of 4 categories, ranging from all the way urban to all the way rural. And in our study, our 13 counties broke down as follows. 3 were entirely urban, according to the Minnesota Demographer's Office. 8 of the counties were urban-town-rural mix. 2 of the counties were town-rural mix, and none of the counties were considered entirely rural. However, in every county in our study, there were several towns with a census of less than 2,500. In this region of the state, manufacturing comprised 25% of the labor force. There were high rates of substance use disorders and rising rates of overdose deaths. There were also a number of strengths in this community. There was an addiction recovery community center, a network of outpatient treatment providers, there were drug courts, and 12-step meetings. What were the actual characteristics of the individuals who participated in the study? We interviewed 34 individuals from March through July of 2017. 19 of the people were in recovery and they were not treatment providers or in the addiction field in any way. 5 people were treatment providers who themselves were not in recovery, and 10 people were treatment providers who were also themselves in recovery. Among those who were in recovery, the length of sobriety was 11 days to 36 years. That's an average of 12 years for our people in recovery in the study. And for all the people in recovery in the study, 100% of them supported their recovery with 12-step programs, whether that was Alcoholics Anonymous, Narcotics Anonymous, or Al-Anon. The study was about half female, little more than half female. People had between 10 and 18 years of education, with 29% of the sample having a bachelor's degree and 12% of the sample having a master's degree. The age of the participants ranged from 18 to 73. The average age was 51 years old. Mostly our sample were white, 88% white, 12% people who identified as Black, Native American, mixed race. Marital status was 1/3 never married, 1/3 divorced, widowed, and 1/3 living with or currently married. In terms of how long participants have lived in the region, this ranged from 1 month to 70 years, with an average of 31 years. And how many years, for those people in our study who were addiction treatment providers, how many years had they been working in the addiction field? And that ranged from 2 to 35 years, with an average of 17 years experience. Now we conclude our second module. We've talked a little bit more about the background of the study, the concept of gossip, shame and stigma and addiction. I've told you my rationale for conducting the study, the methods, the qualitative methods I used to conduct the study, and a little bit about the community characteristics and the sample characteristics. When we meet again for Module 3, we're going to talk more about the study. I'm going to show you the conceptual framework that came from the interviews, the themes that served as building blocks for that conceptual framework, the actual quotations from research participants, and then the implications of the study findings for child welfare. Thank you so much for joining me for this third module. This is how you can reach me. Don't hesitate to reach out, and I'll see you in Module 3.